Happy Friday, Baylor College of Medicine and friends of Baylor College of Medicine. I'm beginning to feel like Rodney Dangerfield here at times. What a week. Every week it seems like something new and crazy is going to happen. So it's been another crazy week in the history of mankind and our global pandemic. So first of all, I was called out a little bit by my infectious disease faculty. They wanted to point out that the WHO study was actually not very well done. And if you recall, last week I had pointed out that the WHO looked at a bunch of different interventions to see if they would be helpful in COVID, and remdesivir was found to be not effective. Well, leave it to the WHO, and of course my infectious disease faculty pointed out that the study was underpowered. So it really couldn't determine whether or not it was beneficial or not. So for example, an underpowered study is one where you have to treat 100 people to find 5 beneficial. If you only study 10, you might not see that same number. In fact, it might be underpowered to show a significant effect, and that was apparently the problem with the WHO trial. In fact, the trial that we were participating in, which was a very strongly powered randomized controlled clinical trial, showed that remdesivir did lower hospitalization by 5 days. So remdesivir is still back in it. We're still using remdesivir to treat. So that's all good. Want to have a little bit of follow-up on the discussion last week with herd immunity. So I am not sure what is going on at Stanford, but they have 2 professors who are big on pushing that we should allow herd immunity by letting everybody get infected. Now, I have a feeling it's the same concept of letting wildfires spread throughout California. So it's not a good idea, but if you can't stop it, whatever. So I believe, because I'm a president of a university, obviously I believe in academic freedom and having everybody have opinions. But I also believe in a very strange, unique concept, which is sometimes they're just wrong opinions. And I think letting everyone get infected is just wrong. And I remind everyone, last week we calculated the number of deaths would be about 1 million people. But there would also be 10 million hospitalizations. And I pointed out that would overrun our hospital systems, and it would lead to a lot of people dying from other diseases. So one person said, "Are you sure that's the case?" Well, interestingly enough, there was a recent paper in JAMA last week that came out from NYU, and it looked at the number of hospitalizations in a particular week by disease. So, disease of the circulatory system like heart failure or stroke. In the beginning of the pandemic, there were about 100 hospitalizations per week. Early on in the COVID epidemic, when things were really getting bad, and at the peak, they dropped from 100 to 40 and then recovered to 60. The same is true of digestive diseases. The same is true of cancer. From 20 hospitalizations per week down to 8.7 at the peak and then up to 12. So these people who would normally be in the hospital are being crowded out by peak coronavirus patients. And that's my whole point. Not only would we have problems with taking care of the people who are sick, we would be crowding out other people who have diseases that also cause illness. And if you recall, last week we talked about excess mortality, where the U.S. led in excess mortality during this period. And excess mortality would include COVID patients, but also these other disease entities. So it's very clear that letting things run rampant is not a very good idea. So there was also one very interesting paper published last week in the British Medical Journal. It was a study in India of 39 hospitals, 464 patients who were randomized to either convalescent plasma or not. And we've been waiting for a study that actually proved whether or not it was beneficial. All of these patients had moderate to severe disease, so they all had low oxygenation. There was no benefit of convalescent plasma. Now, it is true that it may have been used a little bit too late in the process, but we have been a little concerned that convalescent plasma itself probably does not have the concentration of very specific antibodies that would help. And so we're still hopeful that the monoclonal antibodies will be beneficial, but at least convalescent plasma in one large study in India did not seem to be beneficial. So let's look at some of the data. The national data is not good. We are reaching new peaks. It looks like we're approaching 80,000 cases a day. Mortality is beginning to rise. And where is it most problematic? If you look at the nice heat map in the nation, it's pretty clear that the Midwest is leading the way with Wisconsin, Minnesota, Illinois, Michigan, Missouri, really hot spots and real problems. Texas is hanging in there, although it's not the same in every city. We're all about the same except El Paso. El Paso has had this huge spike, just huge spike, and it's not all that clear why El Paso is a mess, but it is. All the other major cities are moving up a little, but are not so badly affected as El Paso. And then if you look in our own Houston community, we're doing okay, but not great. Our R number is still chugging up. It's over 1, so the virus is winning. You know, that's exponential spread. That's not good. Our case numbers are chugging up. They used to be, you know, we were hoping to get them under 200. They're more like 500 or 600. And our percentage of testing positive is now running closer to 4.5%. Before we had it under 4% for a while. And hospitalizations have now gone up as well, as I mentioned before. They were around 80 before, but now closer to 100, 110, 120. So these are all bad signs. It looks like we are in a beginning of a surge. My hope is obviously that it's not as bad as in the Midwest and the Northeast. We have weather on our side. If we can continue social distancing, being outside, that will be a big help. There was a very cool analysis published in the Washington Post. Actually, it was from Carnegie Mellon. Why is this happening? You know, why is the country blowing up just like we all expected? So it's not like it's a surprise, right? We've been talking about this since the spring, that maybe, you know, we'll have a decent summer, but in the fall it's going to be a mess. Well, it is surging in the fall, and it's probably because of weather. It's probably because people are going inside and not able to physically distance the way they could. But it's also people are kind of tired of the whole thing. And the trouble with being tired of the whole thing is people aren't rigorous about wearing their masks. And there was this kind of interesting study by the Carnegie Mellon University that said, what percentage of people know someone who had COVID symptoms? And then what's the percentage of people who wear masks in public? And it's a linear correlation. I mean, it's in the places people are wearing masks the least, they have the highest percentage of where people actually know someone who has symptoms. So it's not a rocket science here. This is pretty straightforward. If we continue to physical distance, if we continue being, you know, rigorous in our approach to this, using public health measures, we will get through it. We are going to get through this, but let's save as many people as possible. This whole concept that, you know, let it go is just so inane. If you think about public health is like the doctoring for the country, you know, and right now our country leads in mortality per 100,000. So if I'm a doctor and you're a patient and I were to refer you to another doctor, I'd say, hey, you should go to this doctor. They have the highest mortality rate in the world. You know, that wouldn't be a doctor you'd really want to see. You know, I mean, the good news is, you know, you go see them, you might not make it, but it'd be fast. Well, that's sort of the concept of letting everything go. You know, we're all terrible doctors, but at least we'll get it over with. Well, that is not a good approach to public health or to individual care or for medicine in general. We're here to try and save 1 million lives, not to lose 1 million lives. So one other great thing this week, unbelievable science. I mean, a really kind of breakthrough this week. We've been talking about the receptor for the spike protein on the virus. That's how the virus binds and gets into cells. And the ACE2 receptor is the main receptor, and that's why it gets into lung cells. But people are going like, what gets into? Seems like it gets into other tissue as well, in the brain and into olfactory bulb where you smell, and in the cardiovascular system. Well, it turns out there's a second receptor, and it's called neuropilin-1. It's a receptor that sits right on the surface of the cell, and it has a little projection like a hand, and the spike protein has another little projection like another hand, and they grab a hold of each other, and it pulls the virus into cells almost twice or 3 times more efficiently than if the neuropilin receptor isn't there. And the neuropilin receptor is abundant in the olfactory cells of the nose, and as you know, one of the most common symptoms is people lose their sense of taste and smell. Well, that's why. And there's been a couple of studies, autopsy studies showing in patients who've died, high correlation of neuropilin-1 on these olfactory cells with high concentration of virus. 2 tremendous studies in Science that showed actually if you add neuropilin, the receptor, to cells, you can show that more virus gets in. The reason this is such a big and important step, another target for therapy. So if we block the neuropilin receptor binding, that might be another way to prevent the virus from getting in. And you could block it through vaccination strategies, or you could block it through small molecules, or even infused antibodies. So lots of different opportunities. This is very important science, very well done, and it should help us a lot in our understanding of how this virus works and how we can treat it. So great science as always. This is part of the fun of the profession. We are involved with trying to take care of people. That's our mission, make people healthy. But the science part of it drives a lot of what we do in discovery and how we can take care of people better. A couple of shout outs. Today, this evening, actually, is the white coat ceremony. This is a really important ceremony in medical students' careers. It's the moment where we put the weight of the world on them. You know, you went from being a college student, having fun, partying, posting everything you wanted on Facebook, Instagram. You put a white coat on them, and all of a sudden, everything they've done in the past is embarrassing and unprofessional. So, it's a very important ceremony. It sort of, consolidates the role of the physician, and it's one that is fairly important. It's very important. Not as celebratory as graduation, but it's a very important ceremony, and that's happening tonight. Also, do a shout out for Nancy Marino, who's got all of the curriculum for K through 12 in public health online. Big shout out for teachers. Oh my gosh, they're having to work, deal with all this stuff by themselves with incomplete guidance, I'd say, from the CDC. So we're trying to help fill that gap, but my gosh, they're really doing the best they can. I want to also remind everyone, just like that paper from NYU, there's a lot of other illness besides coronavirus, and this is Breast Cancer Month. I think it's time to, for mammography and screening. Don't forget routine care. They've just changed the recommendations for colonoscopy from 50 to 45 years of age. Don't put these things off. We don't want people to be dying from other diseases because they're afraid to come to the doctors. It's the safest place to come. Doctors and hospitals still have lower transmission rates than the community. That's because we are, managing our PPE, wearing masks, shields, washing our hands. So don't be afraid to get health care. That can really lead to other problems. Also, of course, it's time to vote. I voted weeks ago, but vote. Please vote. It's very important that people hear get your opinion. And of course, we have Halloween. So there are ways to be safe at Halloween. I went over them last week, but, wear a lot of masks, stay apart, take some hand sanitizer in case you want to eat candy on the way. Just use common sense and don't put a big bowl of things out. And no multifamily get-togethers. That's always a problem. And today, obviously the biggest pressure I have is finding an appropriate outfit for Lily. I mean, she has got to be the Halloween queen. A lot of, I'm sure all you parents out there know what it's like to have the pressure of having the coolest costume for your kid. But luckily, it was easy this year because Dr. Lily is always available for care. Her office hours are open 24/7, and we will be seeing a picture of Lily as she as she goes around collecting stuff. Anyway, have a great weekend. It's been another fantastic week in the history of COVID, and really lots going on. Really great science this week. So have a great weekend, and I'll see you next week. Thank you.